Under Medicare for All, you either take private insurance away from those 170 million Americans or greatly restrict access to it, meaning there is no relief valve for physicians facing up to 40% payment cuts. This would decimate physician networks, creating a permanent physician shortage, and it would leave medical students with no hope of paying off their loans. And the cost of Medicare for All has been projected to be as high as $32 trillion. That's trillion with a T. Basically, if implemented by 2022, Medicare for All would mean that healthcare spending would take up 58% of federal spending, compared to 28% today. It's fiscally unsustainable. But to make matters worse, it would destroy Medicare for the seniors who have spent their whole life paying into it. A promise made to those who paid for it would become an entitlement for all, destroying an important program for those it was intended for. Medical innovation would take a back seat, and we would give up our status as the world's leader in medical innovation. Imagine placing every American under a system where an act of Congress is required to add benefits or to make routine changes. Healthcare is changing rapidly, and we need to have a system that is nimble to respond to it. The reason people are calling for Medicare for All is not because the ACA has worked in remedying what ails our system, because it has not. But their solution is literally to do more of what's not working. It's like the man who has a pounding headache, who then takes a hammer to his head to make it go away.